I think especially more recent investigations of allogeneic transplanted myeloma are clearly trying to take all the risk factors that we know about at the moment into consideration to really investigate which patient group benefits most. I think the investigation of that is slightly made difficult by the fact that mainly very young patients are considered for it, and that's a very small group of patients. And maybe within that group, there is still a tendency to rather consider patients that have high-risk features. So the problem is that the patients that we do see have an allogeneic transplant are already a very selected population. They're not the whole population. In an ideal world, one would just treat a whole group of patients that has all kinds of features to actually find out who benefits most. And I think this is one of the challenges. This is also going to be one of the challenges moving forward into selecting which patients really benefit most, because at the same time, where allogeneic transplant is somehow in a similar place for the last 5 to 10 years, other treatments are really showing a fundamental difference in terms of patient outcome. We have seen, of course, treatments coming on board that are now about a decade ago, but now we are seeing quite a number of therapies that are to be considered second or third generation, especially with monoclonal antibodies, that are actually changing patient outcome with fairly limited toxicity. And that's a big difference to allogeneic transplant. So at the same time, where their benefit increases with relatively limited toxicity, of course, the question about what the benefit of allogeneic transplant is becomes probably more uncertain.